Bismillahir Rahmanir Rahim. Dear viewers, Salamun Alaikum wa Rahmatullah and a very good evening to you all. Thank you for joining us today. For those who do not know me, I am Fatima and I will be your host for today's talk show. It is 31st May, the World No Tobacco Day, and we are here to discuss a little about this biggest public health threat. Tobacco is a cornerstone of many people's lives, and the growing epidemic is raising a huge public health concern. We have known about the dangers of tobacco for decades, and still we've not progressed towards a tobacco-free society. Today's session is mainly focused on the bigger picture, that is, how do we achieve a society which is tobacco-free? Hence the motto on our poster that says, "Do not let tobacco take your life away. #commit to quit." We are honored to have with us here today a few expertise who will help us in achieving our goals. We'll start with a quick round of introductions and then proceed towards the main discussion, inshallah. Dr. Sibtain, can you please start with your introduction, please?
Thank you, Dr. Fatma. Bismillahir Rahmanir Rahim. Assalamu alaikum wa rahmatullahi wa barakatuh. My name is Dr. Sibtain Mouledina. I am a specialist physician specialized in the field of internal medicine. And currently, I am working at Shri Hindu Mandal Hospital.
Thank you so much, Dr. Sibtain. Dr. Shaina?
Assalamu alaikum. My name is Dr. Shaina Yusuf. I'm an emergency physician by profession, and currently I'm running a rehab center in Dar es Salaam at Kigamboni.
Thank you, Dr. Shaina. Dr. Ahmad?
Assalamu alaikum. My name is Dr. Ahmad Shabir Chagani. I am a dentist, and I practice at the British Dental Studio at Sickliffe, Masaki.
Thank you so much, Dr. Sibtain, Dr. Shaina, and Dr. Ahmad for taking out time and joining us here today. Well, we all know that tobacco can be used in various forms, and it kills half of its users. The World Health Organization states that around 8 million people die annually because of the use of tobacco, out of which 7 million die because of a direct use and 1.2 million die as a result of inhaling or being exposed to secondhand smoke, what we call passive smoking. Unfortunately, 80% of the world's 1.3 billion tobacco users live in low to middle income countries, such as our country. The problem with the WHO statistics is that they are just an estimate. And this is where I'd like to direct a question to you, Dr. Sibtain. Do we have any studies conducted in Tanzania, or rather do we have any studies conducted in our local communities to sort of tell us exactly how big of a burden is tobacco in the community that we live in?
Yes, thank you, Fatima. Like you rightfully said, we do not have a lot of official data about the prevalence of tobacco consumption in our country. In fact, the WHO has given estimates only. So the official research, official surveys are not many, but there was one that was done in 2002. So that's almost 18 years ago, 18 to 19 years ago in Dar es Salaam, where a group of researchers surveyed about 600 different people, both males and females. And within them, they found that about 25, so a quarter of those males reported that they were smokers. They interviewed them and they reported they were smokers. And 5% of them, 5% of the females reported that they were smokers. Interestingly, in the same study, these researchers also used a device which they call Smokerlyzer, which is a device that can help detect carbon monoxide in your breath, which is one of the fumes for smoking. After using this device, they found that almost a quarter of the women who said no to smoking were found to be positive in this way, meaning that they were actually smokers, but they denied to be smokers. So in a way, it also shows that it may be prevalent, but it's not very much reported by the people who do consume tobacco. Remember, this is smoking only, not tobacco in general. In our local community, I personally did a study as part of my undergraduate research in 2010, so roughly about 11 years ago. And this included about 400 people, both males and females. Among them, 16% from both sides, so 16% in total, admitted that they were smokers, they were current smokers. And this habit of smoking was closely related to them being depressed, because the aim of that study was to find depression in the community. So smoking had that effect. But unfortunately, recently, we do not have any official research that has been done or any official surveys looking at tobacco in general, because there are many different forms of tobacco. So yes, that is lacking. Although there have been some short surveys here and there in schools where they have seen that it is definitely a growing problem in the community. Young children, as young as those going to primary school, have at least tried once, if not more than once, some form of tobacco product. Even in our daily practice in the hospitals, we come across many patients who do have a history of using tobacco, either smoking or pariki, or both of them at times. And many of them do come with complications related to this product. So definitely, as the WHO has estimated, it is a growing problem, not only worldwide, but also in Tanzania and also in our community in particular.
Thank you so much, Dr. Sibtain, for giving us an insight into the statistics. As you have mentioned, and we've also noticed that we do not have enough studies done in our community. We have very limited information about statistics in our community, and that is why our team worked on a survey form. The link of the survey form will appear on the live chat, and we urge all the community members to participate in the survey, to please take a moment, fill the survey, so you can help us build accurate statistics on this problem. Well, we're living in a very different generation from the generation that our parents and grandparents used to live in. Now, back in the day, people only had access to information using either newspapers or magazines. Now we're living in an information era where information is readily available to especially the younger population via the use of a variety of modern gadgets. Now, until a few years ago, Dr. Sibtain mentioned that tobacco was either smoked or chewed, in the form of pariki. But now we've seen a growing trend of the use of modern products such as electronic cigarettes, vaping, and smoking of shisha is actually seen as a growing trend in the younger population. Now, the multi-billion-dollar industry, the tobacco industry, is evolving, and it spends a lot of money coming up with, sort of these innovative and strategic ideas to pull the youth towards this behavior. It's used in it's used by famous celebrities in movies, and also cartoon characters for that matter, make our younger ones feel that it is a cool and an iconic thing to do. And this is where I have a question for you, Dr. Shaina. I mean, what do you think? What do you think about this tobacco advertisement? Do you think that they are a big influence, or do you think that there are other factors affecting the younger population to sort of get involved in this behavior? Also, what's your take on what parents and guardians should do to protect their children?
Thank you, Fatima. I really think advertisement might be a portion or a part of, a very small fraction of influence to youths or to the society. Because a lot of adverts usually tell you, I have here example, it will tell you do not smoke because it is injurious to your health. For example, this one says, if you can read, it is more dangerous than you think. So I really don't think it is only advertisement. I really believe that youths or children learn by looking, listening, and that is where our role comes in as parents and elders and role models for our kids. So if the parents are having tobacco, chewing or smoking cigarettes or doing shisha at home, and it is okay for the parents to do, then why will it not be okay for the child to do? So I really think people around people or people around kids or youths are more of an influence than advertisement. The other biggest influence is peer pressure. In order to look cool and to fit in that cool group, you have to have those characteristics or share those hobbies like those cool guys that you want to be with. And one of the things, as you said, vaping and shisha is a cool thing for the youths to do, not understanding that the harmful effects of vaping and cigarette smoking or chewing tobacco is similar.
Thank you so much, Dr. Shaina, for such a wonderful explanation. I totally agree with you that advertisements are not the only factor, but rather, as you beautifully explained, that children learn by role modeling and mimicking their adults. And peer pressure is one of the biggest factor that sort of contributes to them getting involved in such a dangerous behavior. China, if you don't mind me asking, I have a tricky question for you. I mean, it may sound a little tricky, but I hope you can enlighten us more. So we're living in a COVID-19 pandemic era. And because of the pandemic, our local centers, such as mosques, put up strict rules and posters regarding strict rules for people to adhere to, such as wearing of masks was made compulsory. Sanitization and social distancing was ensured. And that is great because it really helped us contain the virus. Now that we think of tobacco, and how it is a growing concern for centuries, do you think that putting up strict rules regarding no tobacco or strict rules regarding no smoking in our local centers would have a bigger impact?
I definitely think so, that it will have an impact, at least in those environments where there are cluster of people, a larger group of people like mosques or hospitals or schools or library area or wherever youths meet up, sports places. Definitely it will make a difference if there is no smoking rule. But remember, it is not only smoking that is happening. Okay, the tobacco forms are a lot of different forms of tobacco. So for example, we say that maybe because of smoking, we don't want inhalation, but they don't understand that it's not only smoking that is affecting. Tobacco is not only smoking. It is a lot of other forms of tobacco as well. I really think the posters should enlighten and acknowledge the facts about what are the harmful effects, because just merely saying no smoking or merely saying smoking not allowed, vaping not allowed is not going to help them stop or quit. What is going to help them stop or quit is know it better. What harmful effects does it have? Why should they stop just by looking at the poster? So I really think if you have facts, small, colorful, eye-catching posters telling you facts about, let's say, what is pariki and what does it have, for example, and how does it affect your health in totality, not only in one aspect, then that may be helpful.
Thank you so much, Dr. Shaina, for enlightening us more. I totally agree with you. But also, just to build on that idea, there's something I'd like to share. So, the fact that we allow people smoking publicly, that anywhere, anyone can smoke. I mean, people enter local centers, people enter offices with a lump sum of tobacco in their mouth and spit it on the streets. The idea that we're giving our children is that it's a normal thing to do. And perhaps that is not good news. I mean, our children need to learn that smoking and chewing tobacco or using any form of tobacco is not a normal thing to do. So perhaps we'll leave it as a food for thought for the leaders of the organization to sort of discuss and see if they want to take this up. Now, Dr. Ahmed, all forms of tobacco, be it smoking, be it chewing pariki, be it vaping, have documented to have adverse effects on the oral cavity, on the mouth. Can you please explain to us in a nutshell, what does tobacco do to your mouth? And also, can you please point out what alarming changes should tobacco users look for before seeking a dental or medical help?
Absolutely, Dr. Fatima. It's definitely a tall order to be able to nutshell all the different hazards that tobacco can bring to the oral cavity. But essentially, most people are aware generally of what happens with tobacco usage in the mouth. And they are also aware that sometimes it can be fatal. Now, the changes that occur due to tobacco use can range from harmless soft tissue changes all the way to very lethal events such as cancer in the mouth. Now, I'm going to show you just a few of the things that can happen in the mouth. Obviously, the list is not exhaustive, but these are the few things that you can look out for. So there are going to be a couple of pictures, which I'm going to go through very, very briefly. So bringing up the first picture, you see some discoloration in the gums. That brownish discoloration is not supposed to be there. What is that? It's called melanosis. Essentially, the gums have changed color. Why? Because of tobacco. It's very, very common among elderly men, statistically. It gets worse and darker with more tobacco usage. Most of the time, this is pretty harmless. And the good news is that it can go away with the less tobacco that you consume. Putting the second picture up, so what we see here is a very, very common thing. It's called gum disease. So you look at the gums, and you can obviously see that they are red, swollen, inflamed, and I can assure you they hurt a lot, especially when you chew, and there's a lot of bleeding, especially when you brush your teeth. But don't let the ugly looks fool you. There's actually more that's happening. So the gums, if you see them where they were much higher at this point, way higher than they originally were. They've actually shrunk, and they're not going to grow back. But to add more salt to the damage, the supporting bone underneath the gums, that's also gone too. It's actually been disintegrated, and that's not going to go back either. And what happens when your gums and your bones shrink? Your teeth start to become loose. The teeth may have nothing wrong, right? But they're going to start becoming loose. You're going to have difficulty chewing. And, you know, at some point, these teeth may actually fall off. Yes, that's actually possible. It happens all the time in my practice. I see a lot of smokers, and this is a very, very common scenario. Imagine, perfectly healthy tooth, nothing wrong with it, but it goes away. It's lost forever. And the chances of replacing it are very, very iffy, so to speak. The next picture on your screen is a picture of the roof of your mouth. The red dots you see are inflamed salivary glands. So what is it? It's called nicotine stomatitis, which is Latin for inflammation due to nicotine. So the salivary glands are inflamed, they're red, they're big, sometimes they're painful, usually they heal by themselves, but for some unlucky fellows, these ulcers don't heal, and they may actually lead to cancer. The next picture is particularly interesting for our smokeless tobacco users, which by that I mean pariki, betel nut users and the like. This is basically soft tissue which has been damaged. It has become hard, white, sometimes painful. It also tends to hinder your ability to open the mouth. And the more damage you do to it, it's very likely that it can lead to cancerous lesions. The next picture that you see is a picture of a black hairy tongue. How did this happen? So on your tongue, there are small little growths called papilla. Due to the heat of the nicotine, they get burnt and they get inflamed and they regrow. Sometimes they overgrow and they become very big, as you see. And in addition to the tobacco usage, it gets stained, hence it becomes black. So it's not a very pretty sight. It's harmless most of the time, but again, I don't think anyone's keen on having a black hairy tongue. And coming to the granddaddy of them all, this is oral cancer. Yeah, it is not a pretty sight, and it can occur from any type of tobacco usage. Starts off with a very tiny ulcer on the sides of the mouth, or the sides of the tongue, gets bigger over time, and it's not pretty, guys. It's not pretty. It tends to spread very fast. It can get very big very fast. It can get very painful, and it starts spreading from the side of the mouth all the way to the neck and beyond. Even if you fix this, even if, let's say, you cure this, your life is not going to be the same. Many a times we need to fix this with surgery. So you may end up losing half or all of your jaw, your actual jaw, and you know your life is not going to be the same again. You may be free of the cancer, but I assure you, and I've seen this in patients, that oral cancer that is going to change your life forever, and not in a good way. So like I said, this list is by no means exhaustive, and there are tons of more information out there for you to do your research on. But the long and short of it is, yeah, tobacco and your oral cavity are not good friends.
Wow. Thank you so much, Dr. Ahmed, for such a wonderful explanation. Those visuals were not very pretty visuals to look at, I must say. I mean, tobacco does that much damage to your mouth and oral cavity. I mean, we just have to imagine how much it does to the rest of your body. Now, Dr. Ahmed, you mentioned that chewing pariki is something that causes a lot of changes in your oral cavity. And that is where I'd like to ask you, Dr. Shaina. Some of us really do not know what pariki is. We really do not know what pariki actually contains. And is pariki the only local chewable tobacco available?
Fatima, it's scary out there. There's so many forms of different tobaccos. I would like to show the picture of different kinds of tobaccos that are available. Available here are all the gutkas and the rasilis and manik chand and the XOVs and charsovis and God knows how many other more. There are different types of chewing tobacco available. But now, do we even know what does it have? Because the pariki that we usually buy here locally, they have betel nut. It has sopari. So a lot of us think kali sopari che and a flavor che, but nah, do we even know how they make it? So there is a little bit of lime in it. There is betel nuts in it. And then there is something like this, which I picked up from somewhere today. It's an empty can. But for example, this one does not even tell you what it has. There is no ingredients written anywhere on this bottle. Okay. There was another one which he could not give me because it was not empty yet. It said it has flavor and it has betel nuts and some dry fruits in it, which are also flavored. But you know, the chemical bit of it is not written. Even the Manik Chand packet that is available, okay, it says it has betel nut and flavor only. But we know betel nuts, we know what kind of flavor it can have. But when you open that packet and only try and smell, it's very pungent. Okay, so definitely there are chemicals inside that we don't know about. The locally made pariki here, which these kind of gutkas are put in as flavor, usually are also mixed with lime and betel nut. There are other sweet pariki that they are saying, which is also put in with the sugar syrup and some color to, you know, to attract people to have it, especially kids. Kids are not going to eat something that is bitter. So how do they attract them? By making it sweeter. So there is miti pariki. That is nothing. It's only sopari and sugar syrup and flavor. No, it has so many other, really detrimental contents. For example, why would you not write what is inside this pariki? Why? And it also tells you it is more dangerous than you think. So can you imagine what other contents it might have that we don't even know about, and we are just consuming it because it gives us the high. And the reason of it is there are addictive properties in it, and that is why we can't live without. So starting from cigarette to parikis, right now it's an in thing to have tobacco which is usually rubbed in the gums and around the oral cavity, which is a very impure form of tobacco. It's also called kuberi, which the government really is against having it around, but it's available. And especially in the local markets, local people have been having it, but now our young youths have started using it because you don't have to carry, it's not like a cigarette. So, you know, if they are caught, they'll be in a problem. They don't have to light it. It's just a little small, little powder that they can rub around in the gums and they're good to go.
Shaina, that was very well put. I mean, I'd like to stress this to the viewers. If you do not know what you're consuming, what actually, it contains, Do not take it because it may be really harmful to your body. And I must make a confession, Dr. Shaina. Being someone who works in the healthcare sector, this is the first time I hear about Kuberi. So thank you for pointing that out. Now, Dr. Sibtain, we all know that tobacco causes a lot of several health and psychological problems. It could cause lung diseases, it could cause heart diseases, it can cause cancers, as Dr. Ahmad pointed out, even eye diseases. I mean, it also affects fertility. Now, the good news is that people who use tobacco already know that tobacco is harmful for them. But the bad news is that they cannot still quit. Quitting is a very difficult process for them. So can you enlighten us as to why quitting is such a difficult process?
Yes, thank you, Fatima. So to answer that question, why quitting is difficult for someone, it is not as simple as saying that he should just quit. Okay, there's a whole different process that goes around it. So sometimes we may be victims of judging those who are addicted to tobacco or even other drugs by saying that they are weak morally or they don't have a strong willpower. That's why they don't stop this habit. But this is, in reality, this is called addiction. And addiction is more complex than just having is more complex than this. And it takes more than just a strong willpower to quit this habit. So medically, they have tried to explain what happens when somebody is addicted to a substance like tobacco, for example. So in the brain, in our brain, there are different chemicals that are released in different times, depending on what we experience, what we do in our daily life. One such chemical is known as dopamine. Don't want to get too technical, but dopamine, in other words, sometimes it's known as the happy hormone or the good feel-good chemical. Okay, it's a chemical that is released that gives you some sort of pleasure. Whenever you do any activity that gives you some sort of pleasure, this is released and you feel that sense of pleasure. For example, simple examples like sitting with your family, spending time with them, maybe going to a restaurant, having a good meal with your loved ones. All these are things that give you pleasure, and that makes you go back to doing those things. Drugs like tobacco also have that effect, and in some cases maybe even releasing even more dopamine than the normal activities that you do. So it gives you that pleasure that you want, and that's what makes you go back to it again and again, and that is called addiction. The problem with this is that the addiction, when the person is going back to it again and again, the pleasure that he gets in the beginning stages of using tobacco, a time comes when the same amount of tobacco or the same dose of tobacco that he's using is not giving him that pleasure that he used to get before. So what happens next? He will do something called escalation. He will go higher. He will find something, he will increase the dose of tobacco or any other drug for that matter that he's using to get that level of pleasure that he was getting initially. This is very dangerous. So it is like a vicious cycle. So the more you use, the more you want again later on to increase that dose more and more until you get that initial pleasure that you are getting. But the body gets used to that. So therefore, you don't get that pleasure continuously, that level of pleasure. So what happens now, the person has used maximum levels of tobacco, for example, and he's not achieving that pleasure that he wants. So then this is where another danger comes. Then he starts finding other methods to get that pleasure. And usually that's why we see sometimes people who are addicted to one substance, they get addicted to other substances as well, because they want to bring that level of pleasure that they used to get, that high that they used to get. So this is the problem. This is one angle, the addiction. And why somebody gets addicted and some people don't get addicted, they may try it once and they don't go back to it. There are different reasons. We don't want to get into too much detail, but it is known that especially if somebody who starts at a very young age, or those who've had a rough childhood, maybe they were victims of childhood abuse, wrong types of company, peer pressure, all these things and others also lead someone to get into this phase of addiction. This is one part of this, why somebody keeps on going back to tobacco despite knowing the harmful effects. The other side is what we call withdrawal. So withdrawal is something that a person experiences when he's trying to quit a substance like tobacco. So he gets symptoms, for example, things like the heart starts racing very fast, palpitations. He gets nausea, he gets headaches, dizziness, anxiety, tremors, may not be able to sleep properly at night. So it becomes very uncomfortable in the beginning days of trying to quit. So in order to remove those uncomfortable symptoms and feelings that he's getting, he goes back to tobacco, he goes back to that substance. And therefore, that makes it harder for him again to quit. So it is not a simple process of just saying, I'm quitting today and that's it, I will stop. There's always this chance that you will go back because of all this phenomenon that we explained about addiction and withdrawal. But just remember that if you have tried to quit and you have not succeeded the first time, if you are not successful, does not mean that you have failed the process. It just means you have not completed the process, because this is normal. There are times you will go back to the substance and then you will try quitting again, you will go back to the substance. This is something that keeps going. And that's why it's very important to have a good social support for such a person who tries to quit. So that's why even if somebody knows the harmful effects, it's difficult for him to quit immediately because of all these different things that are happening in the background.
Wow, Dr. Sibtain, that was very well put. Thank you. Now that you have made it clear that it's very easy for us to say that, quit, but, strengthening that willpower and going through the whole process is a very difficult thing to do. And the vicious circle that you talked about has to be broken. And that is what we'd like to emphasize the tobacco users to do. Now, Dr. Ahmad, coming back to you, initially you explained that some oral changes that tobacco needed to are reversible, or safe to say they're non-harmful. Can those changes be used as a motivation to quit?
Absolutely. So I'm going to put up a picture here. I want everyone to have a look at it very, very close. Imagine, if you may, your potential employee or your fiancé came up to you looking like that. First of all, do you want to look like that or even smell like that? Now, looking at the picture, you start to ask yourself a few questions. First of all, as your fiancé, there are a lot of problems associated with this picture, I guess, because it actually turns out that using tobacco may actually hinder your marriage process. This may be of interest, particularly to a younger generation, in that there was actually a study done, not one but 3 different studies, whether a partner would choose a partner on the basis that whether or not he or she is a smoker. And all 3 studies concluded the same thing. Yes, I'd rather choose a non-smoker as opposed to a smoker. Obviously, everybody had their different reasons to why they did that, but essentially, it all came down to the same thing. It turns out smoking can actually affect your employability prospects as well, because yet another study was done as to whether employers would choose an employee whether or not he smokes or not. And employers seem to want to choose non-smokers on the fact that smokers may take more sick days or leave days. Now, it may not necessarily be the case for the grand scheme of things, but hey, you never know. That could actually be the difference between you landing your dream job or not. I mean, it's a possibility. Again, back to the picture, and if you look at the guy, you're going to think, this guy's got a lot of money. You know why? Because it takes a lot of substance abuse to get to that kind of level, to get to that kind of discoloration. He needs to have taken a lot of tobacco for a very, very long period of time. And those things cost money. I mean, the amount builds up. So this guy is religiously spending a lot of money to cater to his addiction. So there is a lot of hard-earned money going down the drain just like that, And in relation to healthcare, it's possible that these people are actually afraid. What are they afraid of? You see, they think they are beyond help. So they think that, hey, if I'm going to go to the doctor, if I'm going to go to the dentist right now, I'm going to get the scolding of a lifetime, I mean, he's just going to go guns blazing on me and tell me, oh, what have you done? Your health, you're hopeless, etc., etc. As healthcare professionals, we want to tell you that it's not the case. It's never too late to quit, never too late to change. Speak to your speak to your doctor, speak to anybody, and like I said, it's never too late to change, and it's always possible to go the other way. Always, never too late. Now, one thing you need to understand by looking again at the same picture is that this guy is not able to chew very well. Because like I said, he's got a lot of gum disease because tobacco causes a lot of gum disease. And he's probably unable to enjoy food because he's probably got a few loose or missing teeth. I mean, let's remember that this kind of staining takes a long time. And in a long time, the tobacco effects have definitely kicked in, and you're talking about major gum disease. And yeah, so he's definitely going to have some bleeding gums or loose teeth, and sometimes the teeth may actually fall out. For missing teeth, and like I said, you can't really enjoy your meals. I mean, you can chew, but it's just not going to be the same. And people who have lost their teeth, they know this. They absolutely know this. There's something very uncomfortable in relation to the same thing, is that sometimes if you lose your teeth, again, you can gum disease, and let's say you take tobacco in whatever form, it can be very painful in the sense that because you lost the tooth, there's a big hole in it. And usually it takes about a week or two for the gums to heal. But for tobacco users, it sometimes may not be the case because tobacco basically stops your normal function of the gum. So that hole is going to be left open. There's going to be infection there. There's going to be something called dry socket. And I can assure you that's very, very painful ordeal. When you get patients who have dry socket, it's usually, smoke. And it's a very painful process because the healing has stopped. It's not working. The healing process has been compromised in some way. So yeah, looking at this picture, this guy is probably in a lot of pain as well. You never know. And one more thing is that, let's say he tries to make a difference and tries to replace his missing teeth. Yeah. Now, unfortunately, sometimes for people who consume tobacco, being able to replace the missing teeth may not necessarily work out because you need healthy gums to support those missing teeth. And sometimes you can pay for a very expensive implant or a bridge or a denture, but just because of you taking tobacco, these things can fail, you know? So imagine spending all that hard-earned money just trying to get your life back to normal, and it's just failing because of what you see in that picture. That's tobacco right there. That's the reason why.
Thank you so much, Dr. Ahmad, for putting it so well together. I mean, to be honest, I really liked the way you put it because as people who work in the healthcare sector, in the medical sector, we use fear, as a component to motivate people to quit or to motivate people to follow protocols. Just for instance, if a patient comes to me with high sugar, I'm going to tell the patient, look, your sugar is high, and if it consistently remains high, you will have a lot of problems later on. But then you really enlightened us on focusing on the psychosocial and the economic aspects of tobacco also, which was really great. Thank you for that. Now, Dr. Sibtain, we have actually received a question from the public. This person asks, I'd like to quote him, I have been smoking for over 15 years, and I think that the damage is already done. Do you think quitting at this point will help me? Can you please enlighten us more?
Yes, so it's a very interesting question. So even if somebody has been using tobacco for 5, 10, 15 years, if he decides to quit, if he or she decides to quit today and does stay on this track of quitting, the benefits of quitting would be seen almost immediately. And the effects and the benefits of quitting keep going as long as the person is not going back to that tobacco. So, and these are things which are seen again by researchers, and it's very well proven in different studies. So apart from the obvious, if you look at the immediate benefits, apart from the obvious fact that you will save money from not buying all these tobacco products and spending all this time in it. But you will also stop and sometimes reverse some of the harmful effects that it has given you. So for example, your taste will improve, your sense of smell will improve, the yellowing that you get on the nails or on the teeth will also stop. Just normal activities like walking or climbing stairs, which would make you tired initially, now that you have quit, it becomes easier and you become less tired as time goes on. So these are immediate benefits of quitting. So no matter how long you have smoked, of course, the earlier you quit, the better. But even if you have smoked for a long period of time or use tobacco for a long period of time, the immediate benefits are seen, definitely are seen. But more than that, further than that, there are long-term benefits. So again, these are from different researches that within the first few weeks to months of quitting, the person's heart rate and his blood pressure drops to a normal level, or at least to a near normal level. His, what we call the carbon monoxide level in the body, this is the toxic fume from the cigarette, that goes down. And it is the carbon monoxide is very toxic to the body, so that goes down. Your breathing becomes better, right? Your lung capacity becomes better, so you can do more activities for a longer period of time without getting tired, as compared to what was happening before. Having a cough, many of times these people tend to have a very chronic or very long-term irritating type of cough. That also goes away within a few weeks to months of quitting. After 1-2 years of staying in this program of quitting tobacco, your risk of heart attacks goes down also. Your risk of cancer goes down also. Your risk of diabetes goes down also. So all these different complications that come as a result of tobacco, the risk of all these things come down. In fact, even more interesting is that if somebody stays in this path of quitting for at least 15 years, and no matter how long he had smoked before, it is shown that this person, after having been free of tobacco for 15 years, his risk for getting heart disease or cancers is the same as the risk for somebody who has never smoked in his life. Okay? So you can almost reverse all those risks, all those dangers that you are putting yourself prone to when you are using this tobacco. So like Dr. Ahmad very well said in his statement, that it is never too late to quit. Don't despair, right? Never lose hope that it is too late for me now, that there is no chance that I can reverse what I've done to myself, so I might as well just continue. That's not true. Okay? There is always a good time to quit. It is always a good time to quit, whether it's now, whether it's later, but it's always going to be beneficial to you.
Thank you so much, Dr. Sibtain, for such a wonderful explanation. Just to build on what you've said, you mentioned that right after quitting, a few minutes later, changes happen to your body, like positive changes. And this is what we want to stress to the viewers. Whether you've been using tobacco for 15, 20, 25 years, whatever number of years you're using it for, any day that you decide to quit is your day, is your best shot. Because right after you quit, your quality of life will just be different and much better. Now, when we speak of quitting, Shaina, it is still a major concern. So I was actually reading a few studies while preparing for the talk show, and I came across a study that shows that 9 out of 10 smokers, that is 90%, who began smoking at the age of 18 just could not stop smoking. Now, psychologists say that the first step to quitting is to sort of identify that the problem exists. Tobacco users have to accept that there is an addiction problem. That is the first step. And then the next step is to strengthen your willpower to quit, which is the hardest step, to be honest. So can you tell us more on how can one strengthen their will to quit? And also, if a person decides to quit, then what? What should he do? What is the correct channel to follow so that he's successful in that process?
Thank you, Fatima. This is very important what you have brought up. It's true that the first step is to identify that there is a problem for any addiction, especially with the substance addiction. Now, how do we do that? Somebody has to accept there is a problem when they know what is wrong. If they don't know what harmful effects tobacco is going to have, they are not going to be, you know, satisfied with quitting. They will want to continue using what they're using because it makes them feel good. The bad feeling and the pain and cancer and all that comes later after so many years of usage. So how do we make them not reach there and want to quit before they reach there? By explaining them, giving them the knowledge that what are the harmful effects of those substances that they are using. Tobacco being one of the most harmful, one of the addictive substances that causes a lot of harm throughout the body, is very easy, because especially when they are selling it, all over the place it says that it is harmful. But the way it is portrayed, it is in a very negative way. Only so small statement is written, and that is it. They are not being taught, for example, the way Sipten explained about the dopamine surge, about how dopamine starts decreasing, the secretion of dopamine decreases with the usage, and then they have to increase the dose. Once they see and understand all these things, that is when they will have the will to stop. When they do have the will to stop because they are tired or they are sick, then the other two very important components comes in. Okay, it's supposed to be a triangle. If you can show the diagram of the triangle, the person who is using the substance comes on top because he is the problem. He has the problem. Then the two other supporting things that are actually holding the triangle into a triangle are family support, and the other is professional help. So counseling all the time, giving them, you know, positive thinking, giving them hope is very important. While these two people can do it, the counselors are supposed to be giving that to them, and the family support is also very important. Somebody might decide to quit in the family, okay, which is very hard. Anything addictive is very hard to quit, okay? And then right next to them, somebody else is smoking, for example. This is not going to work. You have to be supportive. For example, Pariki, somebody has cancer in the family. They have stopped, they have been told, and they are forced to stop it. Okay. Now they are going through the craving, the psychological dependence on it, the physiological dependence on it, and then somebody else is sitting right there chewing Pariki in front of them. It has to be having, in order to have this stable quitting, the support has to be there from both sides, the professional side as well as the family side. I think this is what it makes hard to quit for other people. So if we do provide this professional support and family support, it is easier. Remember, the triangle is not going to be complete until all these three components are fulfilled.
Wow, thank you, Dr. Shaina, for putting that so well together. I mean, it's sort of clear in my head now that the process of quitting is a multifactorial and a multidisciplinary process. It just does not involve the person who decides to quit, but also involves a lot of people around. And if that is achieved right, then quitting slightly becomes an easier task. Dr. Siptain, we've actually received another question from the public, and I'd like to quote this person who asks, well, I have been smoking for over 25 years, and I recently developed a lung cancer and decided to quit. Now, during my journey of quitting, I was prescribed a nicotine replacement therapy, and it was not effective. So this person says that the nicotine replacement that he was prescribed was not very effective. Dr. Siptain, can you tell us what forms of nicotine replacement therapy exist, and are they really effective in helping a person quit?
Right. So in order to understand this point, in order to understand what nicotine replacement therapy is, we need to understand what nicotine is first. So nicotine is one of the addictive substances which is present in tobacco. Okay, just one of them. And it is the one which is probably the most studied and well known. So that's why there are many approaches using nicotine. So what nicotine is that once somebody uses tobacco, this nicotine goes into different parts of his body. And when he tries to stop tobacco, the body parts that were getting nicotine are now craving it because you have stopped it. So what the approach here with this nicotine replacement therapy is, or NRT, is that they give nicotine only so that those cravings are taken care of without getting the harmful effects of the tobacco. So that's the whole idea behind this type of treatment. And it is available. Nicotine is available in different forms. So it can be given as, for example, chewing gums. It can be given as patches that you put on the skin. There's a common one that we find here, but there are also lozenges, there are also inhalers, there are also nasal sprays which are available. And they come at different doses depending on what the person requires. But one thing to note is that nicotine will only take care of the physical symptoms of the craving. So what do I mean by that? So if somebody is having, like we mentioned before, the withdrawal symptoms, let's say of nausea or a racing heart beat, palpitations. So the nicotine will help take care of that possibly. But if somebody is having the psychological symptoms, right, he's getting anxiety, might get tremors, he may not be able to sleep, the nicotine may not necessarily help in that area. So that's why it becomes difficult. So if somebody is using just nicotine to try and quit smoking, for example, it may not work for him because it is not taking care of all his cravings. That is one reason. The other aspect is that, like Dr. Shaina mentioned in her statement before, that the products that we have today, the tobacco, does not only contain pure tobacco itself. It is usually mixed with a lot of other substances. So the person who is taking nicotine replacement therapy is trying to fulfill that craving of nicotine which is there in tobacco. But we have not taken care of all the other cravings that are present in the substance that he was using. Okay, so that makes sometimes somebody feel that this nicotine is not working, this nicotine replacement is not working. What this just means is that it's not necessarily that the nicotine is not working, it just means that the person needs more than one form of treatment. So there are different other forms of treatment that need to be combined with the nicotine replacement for it to be more effective. It has shown to be helpful in many people, but again, doing it alone may not necessarily help. And that's why maybe people fail when they use just nicotine as a way to get away from this habit or to quit this habit. But one thing I should point out here is that even whether somebody decides to go for nicotine replacement or any other type of therapy, it has to be done under this close supervision and guidance of a qualified professional. Someone should not try to go to the pharmacy and over the counter just purchase this nicotine gums or patches. It has to be a controlled way of administering this therapies. So it has to be done by qualified professionals so that it is more effective in the long run.
Thank you so much, Dr. Sibtain, for such a wonderful explanation. Now that you've put it so well together, I understand that nicotine replacement on its own might not be 100% effective, and it might have to be combined with other therapies that we'll talk later on this talk show. Now, as we mentioned earlier, that until a few years ago, tobacco was either smoked or chewed in the form of pariki. But recently, we have seen a growing trend of the use of the modern products, such as electronic cigarettes, like vaping and the smoking of water pipes, what we call shisha. Now, our team worked on a video whose link will be posted on the live chat. This is a video regarding the harmful effects of shisha. And we'd like you to watch it and also spread awareness because it's something that is very trendy today amongst the university students, the younger population. Now, when it comes to vaping, Dr. Ahmad, many health advocates think that vaping is actually a better alternative to smoking. What's your take on that?
Yes. So, with regards to that question, first, I'd like to define what all this is about. So, essentially, we're talking about something called an e-cigarette. So, what is an e-cigarette? It's an electronic device which heats a liquid and produces aerosol or small particles which are released into the air. They're known by a couple of different names such as e-hookahs, mods, vape pens, vapes, tank systems, etc. And using these e-cigarettes is sometimes known as vaping. So long answer, short answer. Is it better than smoking? Short answer, no. Long answer is because just like smoking a cigarette, it comes with its own set of problems, which builds up over time. So as I was saying, it may seem like a good option, but it may not necessarily be the case, because when you are inhaling the liquids or the oils from a vape, let's put nicotine aside. There are a lot of other garden variety of harmful substances in the mix for you to enjoy, not including and not limited to heavy metals such as lead, nickel, titanium. Could be any of those things, but I'm not sure if anybody wants these metals inside your own lungs. You've got volatile organic compounds, which is diacetyl, and you've also got other different types of cancer-causing substances. Now, here's something you guys may want to be aware of. You may tell me, oh, but we got vapes which are nicotine-free, you know? But guess what? They're lying to you. Why? These 0% nicotine vapes have been tested out and have been found to actually have nicotine in them. They're lying to you. They want you to have nicotine. They want you to get addicted to this stuff. This is how they stay in business. You see, they put the nicotine in there, but they just add the extra flavoring just to make it nicer. The nicotine gets in there and gets you hooked on it. And it's not a very long journey for you to start vaping, and slowly asking for the bigger hits, and eventually transitioning into smoking. You know, I mean, it's really not that hard to. It's like what Dr. Substain said about escalating. You're going to have that small dose of nicotine. Eventually, you're going to want more and more and more. So even if you're not going to switch to a cigarette, you're probably going to vamp up your vape and take it with a lot more nicotine as you would think. So now vaping has actually been proven to cause a lot of damages, especially to our younger adults. So apparently vaping affects libido. Yeah, studies show that vaping affects libido. I'm not going to delve too much into that. If you don't know what libido means, then you're probably too young to understand what that is about. Now, to the adolescent brain, for my younger brethren, your brains are developing very quickly, very quickly, up until the age of 25. And vaping, with all its beautiful ingredients, including nicotine, stops that from happening. It actually makes you dumber in that sense. Yeah. Another thing it stops from happening is your ability to learn, to control your moods, and to control your impulses. All these centers in the brain responsible for these three things are actually targeted by this stuff, especially nicotine, in the vapes, and it prevents that from happening. So it's basically stunting your growth. Now you want to develop yourself as much as you humanly can. So don't vape, because this thing stops you from getting better. Let's say, again, young brothers, you want to learn a new skill, you want to learn a new trade, you want to learn things. So what's happening in the brain? You've got synapses, you've got connections forming in the brain, right? And that's happening very rapidly, very fast, very effectively, but you're a vapor and it comes right in the way. It literally stops those things from happening. So you're not functioning at your best just because you chose to vape. And like I said, it can cause addiction to nicotine. It doesn't take very long for you to start vaping, eventually move on to heavier stuff. Even if it's not cigarettes, could be the Juul, which is more nicotine based or whatever. But it's all just one straight line, you know, to addiction, because they want you to be addicted. Here's an interesting one. You lose your sense of taste. It's called vape tongue. And it's been proven that vapors have been known to complain of loss of sensation of taste. So I don't think everyone's a foodie pretty much these days, and vaping will not help the case. So yeah, you don't have to vape. There was actually another outbreak just last year. I'm talking 2019 to 2020. It's called the vaping lung illness outbreak. Look it up. Youths aged 18 to 34, millions of them, were hospitalized. Why were they hospitalized? Because of lung injury. Lung injury. And they all had one thing in common. You guessed it, they vaped. And the damages was not pretty. It varied from medium to worse. And you know, some people were damaged for life because of these things. So, young brothers, and to everyone out there, the very simple aspect is just don't vape.
Wow, thank you so much, Dr. Ahmad. You put it so well together and it was so comprehensive that I have nothing to add on. But I'd just like to add a statement from the Center for Disease Control and Prevention, the CDC, that states that until researchers find out what is behind vaping-associated lung injuries, do not vape. So it is safe to say that vaping is not a better alternative to smoking. Now, as mentioned earlier, Dr. Sibtain, we had some statistics provided by WHO where I said that 8 million people died annually, out of which 7 million are a result of direct tobacco use. And 1.2 million are a result of being exposed to secondhand smoke, what we call passive smoking. Now, it is quite unfortunate that we take this situation very lightly. I mean, we could be sitting in a room with an elderly smoking, we'd be sitting with friends smoking shisha, and we're not doing shisha, but we're sitting with them, socializing with them. And to make it worse, sometimes a child or an infant is in the same room where the adult is smoking. So what's your take on that, Dr. Sibtain?
Yes, thank you, Fatima. Unfortunately, this concept of secondhand smoking and passive smoking, it is not given that much importance as it should be, because it is, if not as harmful, it is probably even at times more harmful than first-hand smoking. So what do we mean by secondhand smoke? Secondhand smoke is the combination of the smoke that comes out from the burning end of the cigarette and the smoke that is breathed out by the smoker. So, and scientists have studied this combination of the secondhand smoke, and they have found that it actually causes a lot of serious health effects. It contains in itself 7,000 different chemicals, and about 100 of them are toxic to the body, and around 70 have been found to have the ability to probably even cause cancer. So it is not a harmless thing. It is something which is very dangerous and something that we should be very much aware of. The added problem with secondhand smoking is that not only does the smoking affect the person who is smoking firsthand, it affects, it creates health effects and harms to those innocent people who are sitting next to the person who is smoking. And many, more often, these are young children and infants, okay, who are being exposed to this secondhand smoke innocently. They are not even smoking themselves, but they're getting the effects of smoke because somebody near them is smoking. So in addition to the harmful effects that we know that come with smoking in adults, like we have mentioned, things like heart disease and lung disease and stomach ulcers and cancers and oral cavity problems, brain development issues, this all occur also with secondhand smoking in adults. It also affects them. Not only does first-hand smoking do that, but also second-hand smoke affects adults in that way. But even more dangerous and problematic is the effect of second-hand smoke on the children and the infants. So there are studies, again, these are studies that are done in different areas that have compared children of parents who were smoking and children of parents who do not smoke. And they have found that those children whose parents used to smoke or are still smoking, these children develop more frequent respiratory and lung diseases like bronchitis or asthma or pneumonias. They have constant wheezing and coughing. And more often, even ear infections. And more often, these infections and these conditions are quite severe, sometimes even life-threatening. So imagine this child who is innocently sitting next to a smoker is getting affected by all these illnesses and suffering. because of the habit of somebody who is next to him. Looking at infants, those who are younger than 1 year old, there is a condition called SIDS, S-I-D-S, which stands for Sudden Infant Death Syndrome. What it means simply is this is where an infant dies unexpectedly dies because of a reason that we don't know. It's a sudden death. Okay? Why this happens? So scientists and researchers try to find out what happens so that they can prevent these things from happening in the future. So they have studied. So those infants who died because of SIDS, who died suddenly, and those infants who died from other causes, other known causes, they have found that the lungs of these infants who died suddenly have more nicotine in them. Okay, and where does nicotine come from? It comes from the secondhand smoke that they are exposed to, usually from the parents of other family members who are smoking when the child is in the room. Okay, so these effects are not harmless. They are very serious, very dangerous to the young children if they're exposed to this secondhand smoke. How can we prevent that? What can the parents do? Very simple. Don't smoke. Okay? And don't let anyone smoke near the children, whether it's at home, whether it's in the car, whether you keep the windows open, you keep all the doors open of the house, it doesn't matter. As long as the child is near you, is in the same area as you, as the person who is smoking, he is getting affected by this secondhand smoke. Another group which is affected are pregnant women. Okay? Pregnant women, we know, everyone knows that pregnant women are recommended not to smoke because it affects the child, it affects the pregnancy. But secondhand smoke also affects them in the same way. It causes birth defects in the child. It causes premature birth. It can lead to miscarriages even. Okay, so all these problems are there with secondhand smoke. So it is not a simple and harmless thing. It's something which should be taken very seriously and something that people should be very much aware of. And this effect applies to all types of smoking, right? Whether it's the normal cigarette smoking, whether it's shisha, whether it's vaping, these effects are there throughout. So secondhand smoke is something which is very, very dangerous, yeah, and we should be aware of that.
Wow, Dr. Sibtain, you put it so well together. Thank you for that. I mean, I don't have anything to add, but just to emphasize that secondhand smoke is very dangerous. And as Dr. Sibtain said, that you should not be in the same room as a person smoking. Now, my last question is directed to you, Dr. Shaina. Earlier on, Dr. Sibtain actually mentioned that nicotine replacement therapy on its own is not 100% effective, and it should be combined with other therapies. Now, can you enlighten us as to what other therapies exist?
There are so many therapies available. There is hypnotherapy, there is psychotherapy, there is behavioral change therapy, there is positive thinking therapy. There are so many therapies, and they all work, but they will not work alone. They have to be working with the support of the parents or the loved ones, together with the professional support, together with the will of the client or the person who is affected with the substance. Alone, it is not going to work. And that is why when he was talking about nicotine replacement therapy, on its own, it's not going to work, because remember, it's not only the nicotine, first of all, inside. And then why should they stop when they are getting other, they are getting high with it. They feel that they can do stuff with it. Early on, this is what they feel. The bad changes or the bad effects comes later. So alone, any therapy doesn't work. Okay, there has to be combination of the therapy together with the willingness and together with the professional help.
Thank you so much, Dr. Shaina. So to summarize, basically, if you decide to quit, then you need something for your typical craving, and you also need mental and psychosocial support in a nutshell. And that would really sort of make you successful in quitting. Now that we have known of the effects of tobacco, it is a choice that you have to make. Do you want tobacco to take your life away, or do you want to live a better quality of life tobacco-free? We thank our speakers for joining us today and sharing such brilliant insights into this discussion. We also thank you all for joining us and for staying with us. We hope that you learned a great deal of things, and we really hope that this session will serve as a motivation for tobacco users to quit. If you're ready to quit, there'll be a number that will appear on your screen. Please contact the number. Be rest assured that your privacy will be given utmost importance to, and your confidentiality will be maintained. Lastly, let's take a few seconds to pray for all those who are sick around the world. There are many people who are suffering from COVID-19 and other diseases, such as people in India. And there are many people who are being oppressed, such as people in Palestine. Let's take a few moments to please pray for them. وآخر الدعوانا الحمد لله رب العالمين.